First thing I want to share with you is across the top of this is Crohn's disease. Across the top here are different drugs that are on the market, all except for the last column that are including the last column, which is the newest drug. And on the far left-hand side here is how they were approved by the health authorities. And the reason that I'm highlighting this is most of the drugs that are out there, Remicade and its biosimilars, Humira and its biosimilars, Entyvio and Stelara, all of them were approved based on whether they could get you better symptomatically, or patients better symptomatically. And, your question should be, well, Dr. Panaccione, I thought mucosal healing was important. It is important, but it's taken a while for the regulatory agencies to recognize the importance of that. And when we talk about these new therapies, risankizumab, which is now available in Canada, called Skyrizi, it was the first therapy that not only had to be approved, not only had to make patients symptomatically better, but it needed to prove that it could achieve mucosal healing. So the uniqueness of that is the bar by which this drug was approved is higher than any bar that's been put before any other therapies, which means that in order to achieve that, the patients that went into this trial, they all had damaged mucosa to begin with. And now we know the true potential of the drug therapies we have. And this is similar in ulcerative colitis, where starting about, I'd say 10 years ago, we started, as opposed to Crohn's disease, which is more recently where we've looked at mucosal healing.